Welcome, everybody. Welcome to our Push for Empowered Pregnancy talk with March of Moms this evening, March for Moms. We are collaborating with March for Moms in an effort to raise awareness on stillbirth as well as maternal mortality. We are so happy to be here tonight. And before we get started and introduce everyone, if you have any questions throughout the evening, please put them in the chat and we will definitely try to answer as many of them as possible. So I am here tonight with Marjorie, who is also a PUSH member. She's the co-director of awareness. Marjorie, do you want to introduce yourself?
You introduced me, but yes. My name is Marjorie Vale. As Liz said, I am co-director of awareness with my partner, Anna Vic, who is awesome. And we're so excited to be speaking with March for Moms with Yuliya. And hopefully everyone will get something really informative, not hopefully. You will get something informative that you can disseminate to your family members, your friends, because we want healthy pregnancies and we want healthy births.
And Yuliya, do you want to introduce yourself?
Sure. Thank you so much for having me. My name is Yuliya. I am a certified nurse midwife of about 7 years, and I also work for March for Moms, and I do a lot of their policy and advocacy work. We've recently been working a lot with Push for Empowered Pregnancy, and it's just such an important topic to discuss and raise awareness and kind of meet our families where they are and help as much as we can. So we're super excited and thank you for having me.
Yes, absolutely. So let's get right into it. We know there is a link between stillbirth and maternal mortality, right? Can you talk a little bit about just March for Moms and what you are all doing in the space right now and how we can kind of bring in our work at Push for Empowered Pregnancy to support the work that March for Moms is already doing, and then also kind of amplify our message of stillbirth prevention within that?
Yeah, that's a great question. So yes, you're right. There is an increased risk of maternal mortality in presence of stillbirth. Lots of families and birthing people undergo complications that are associated with stillbirth that can increase their chance of poor pregnancy outcomes overall for the birthing person as well. So things like high blood pressure, increased bleeding, placental problems are among some of the things that are associated with stillbirth, or folks can have a higher chance of having a stillbirth if they have those complications. And so obviously those complications affect the mom, the birthing person, and that can increase their chance of having a bad outcome with their pregnancy for their own health. So in thinking about stillbirth and thinking about families that are affected by stillbirth, we definitely have to account for medical problems that can arise for the mom as well. Some of the kind of overarching work that we've been doing from the very beginning at March for Moms is to draw more attention to the maternal mortality crisis in our country, where, you know, in the United States, we spend much more funding per person for someone to have a baby, but our outcomes don't kind of match that great investment that we put in. So lots of moms experience increased complications and unfortunately deaths as compared to other countries that are kind of on par with how we provide care. So we at March for Moms have been raising awareness, which is, I think, is such a big part of it. And I think PUSH is done a phenomenal job with that in stillbirth. And then we also work on the policy and advocacy side to really give families and parents the information and power to do something about it, because I think sometimes it can be quite a heavy topic for for families, of course, but also for their friends and people in their circle. And so we work a lot with promoting legislation, so bills that can improve the lives of families and moms and babies. One of the biggest ones that has been moving through Congress with lots of support from maternal organizations like ourselves and ACOG and PUSH, and just really most everybody is trying to get this through, is the Momnibus Package. That is a package of a lot of different bills that are aimed to decrease maternal mortality and improve the health and well-being of moms, especially Black moms and women of color, which, those populations tend to have worse outcomes with pregnancy, many times having to do with our medical system and how we treat women of color and racism. And so a lot of these bills address that portion of it, educating providers and doulas and all healthcare personnel on disparities, but also providing funding for states and local organizations and providers to get better educated on all of these signs of all the things that we've talked about and how maternal deaths can be prevented. So, I'm taking push with us too here. And I know you've been doing all the work as well all along. All of us have been really rallying behind this. That's one of the things that has been really important this past year specifically.
Yeah, I know I've been following, I'll be honest, it wasn't until I entered this space as a lost mom that I really focused in and then learned about Momnibus and saw, all that you were doing. And now with PUSH, I'm super involved. And so seeing with stillbirth prevention, the legislation that's been put forth, we have the Maternal and Child Stillbirth Prevention Act for Title V, which is amending Title V to just simply include the word stillbirth.
So important.
In Title V, but then again, I also never knew stillbirth still happened until it happened to me. So I think there's just a lack of knowledge. And so I'm hoping with that piece of legislation, it can move through, as well as the Shine for Autumn Act, where finally funding will go to states that, for stillbirth data. And, you would just think that between maternal mortality and stillbirth, that this stuff would have already been done.
Mm-hmm.
And if it was already done, then maybe we wouldn't be 15 years, there's been no progress in our statistics, right?
Yes. Mm-hmm.
Yeah.
Yeah. And to your point, collecting those statistics. So even that is such a big barrier.
Right. We collect data on so many things in this country. You would just think that the health of women and babies would be part of that. And it's, again, it's really not until you are a member of this space that you step in it and you see, oh my gosh, we have some change to be made here.
Yeah, and it's a long time in change, as someone who's experienced a stillbirth myself, and it was almost 18 years ago that I experienced a stillbirth, and the fact that we're still talking about it in such an alarming rates is crazy. And also had a sister who passed due to maternal morbidity, not due to maternity, pulmonary embolism, and that's because she wasn't monitored the way that she was supposed to. No one listened to her, and that was 24 years ago. And we're still at the same crossroads, right? Still at the same street, standing and waiting, for someone to listen to us. And I think oftentimes that people, when they think about stillbirth or even a maternal morbidity, they think high risk, right? We don't think about low, you don't need to be high risk. Can you talk a little bit about that?
Yeah, for sure. And in my everyday job as a midwife, our counseling is tailored to the client. However, we do kind of go over the same signs with all individuals to kind of help prevent poor outcomes, including stillbirth. But you're absolutely right. Lots of families will have no risk factors for stillbirth and still experience it. And that can be even more, I feel like, confusing to people because they are not able to kind of have any kind of reason or just some connection as to why that happened to them. But it's really important to know that it can happen without any risk factors. And I know that can be scary. I think there's like a balance of course, of education and supporting just like happy and healthy pregnancies, but really being a good advocate for yourself. And that doesn't mean that really, I think that word can just seem so like ceremonial, but that doesn't mean you have to do anything different than just ask questions when you don't feel like you understand something or clarify. Doctors, midwives can sometimes just, we're all different. We all explain things differently. So I think being empowered to stop us or ask us extra questions or discuss even heavy topics like this is really important if that's going to provide reassurance and provide like what to do when you go home. I think when people get home, it can get very scary. Like, is this what I'm feeling normal? Is this not? And you should feel supported, and you should feel like you're in a space that you can ask questions or call. Even, I always tell people, if it's 2 a.m. and you don't feel right, just call us. We that's why we're there. But yeah, I think that's an important point for families to note, because it can happen kind of across the spectrum of all pregnancies.
Absolutely. For me, I had a low risk textbook, perfect pregnancy, yada, yada. And, on our push website, we have a PDF of empowerment tips.
Mm-hmm.
And I wish that I had that because, at midnight when I'm texting my doula saying, I haven't felt the baby move, but I don't want to be annoying. I was so worried and consumed with being annoying. I'm a first-time mom. Hospitals, it's COVID. They don't want to listen to a first-time mom that's just worried.
Mm-hmm.
And it was my doula that said, no, you have to call the hospital. The midwives will take you in. You have to do it. I just wish that it didn't take me so long to finally reach out and say something. And I also think of, I was, fortunate enough to have a doula that I could quickly text and ask a question to. That's a luxury in this country. That's not reality for many families. And so I could have gone a day or two without doing anything at all, maybe waiting for my next appointment, which was just a few days away. And so if, birthing people are doing that, then you're also putting yourself at risk.
Mm-hmm.
So definitely getting that message of advocating for yourself, and just, there's a lot of fear sometimes in our medical system, and we need to try to take that out for pregnant people because it could affect us as birthing people and our babies as well.
Yeah. Just so you know, for those who are watching, you can ask questions on the Facebook Live. We're here to answer all your questions, your wonderings. We do have a question, and the question is for you, of course, Yuliya. What perceptions or misconceptions of those who have suffered maternal death have you had to break down for lawmakers and the public?
That's a great question. I will start out by saying that actually our we're the experts, like the parents, the families, the providers, but more so really truly the families, whether they have had experience with the stillbirth or a complication or not, are really the experts at talking to lawmakers. The stories are what carries the most power and provides lawmakers with the information needed to change things through legislation. So that's number one. And many times when you meet with lawmakers, they're a lot of times hearing, like many of the public are hearing about a maternal health crisis in the light that we explain it for maybe the first time, or maybe they've heard about it in the news, but they haven't really met anybody who really underwent this as a life experience. So I would say in good news is that there hasn't been a lot of like questions about any kind of negative perception as to why these outcomes happen to families or moms. And so meeting with legislators, they're really there to listen, and their staff. So that's been like very, very beneficial across the board in a bipartisan way, because a lot of this legislation does have bipartisan support. So that's number one. But I would say overall in general, kind of in the United States and how we receive care, including maternity care, there are misconceptions about how care is accessed. Did people come to their appointments? Are they really completing the testing that they should? Lots of questions that pop up in the chat every time like one of these things happen, and I just scroll through, and I think maybe that's what this question is alluding to. But really the bottom line is the best answer to this is that all these problems are systemic. It's not one thing that causes them. So it's not you as a parent, it's not your family, it's not like where you live, or what kind of access you have to care. So it's not just that one thing, it's multifactorial. So that's the point that we try to make, because if we look at it from a lot of different angles and address them all, hopefully as much as we can move closer to resolving the problem, as opposed to working at just like one little thing. I don't know if either of you feel that way with your lived experience.
Yeah, I mean, I do. I think that if we were able to change just a few pieces of, prenatal care, it would end up saving thousands of babies' lives, and also birthing people's lives too. And I'm hoping that between a collaboration with Push and March for Moms, we can, we're both inching closer, and I feel like together could even be, more of a powerhouse in seeing this change being made. Did we have another? I want to make sure that we're answering all the questions before I keep.
No, not right now. But I did want to say that one piece that we need to look at as well is this the lack of. I mean, it's monumental. What I'm going to say, it's a huge undertaking, but in looking at the healthcare providers themselves, right? I've spoken to. Interviewed many doctors, and I asked them about their training, and when it comes to stillbirth, what comes up, and they would say, we talk about it for like 5 or 10 minutes, and that's it. It's not common practice for them in medical school to be trained into what to do, what happens after, what happens if, because the expectation is it really doesn't happen, right? And so I think if we're wanting to affect change, I feel like that's one of the areas that needs to be focused on, is the lack of training that happens in medical schools with doctors not seeing this as a epidemic. They're just seeing it as a minor thing that happens when it comes to maternity.
Mm-hmm. And that also leads, I feel like, to a sequelae of maybe not the best care for when the family's already, there's been a diagnosis of stillbirth, and what happens after. There's on all Push, like everywhere, we read that there's not a lot of, I've read that there's not a lot of providers who are comfortable talking about follow-up testing and autopsies for families who've experienced stillbirth. And that is different in different countries who have the same resources as us as well. So I think being educated on it, that it could happen, can also help us be there for families better when it does happen, because we do know that it does. So yeah, I agree with you.
And how many times have we been told, oh, sometimes it just happens?
Mhm.
I mean, I was told that, and it wasn't until, I got connected with Dr. Kleiman that we were actually able to find the true answer as to what happened to Aaliyah. But when I left the hospital and follow-up appointments, it was, well, it just happens sometimes, but I'm sure it won't happen again. Well, I thought I was assured that it wasn't going to happen the first time, and here we are. And so, yeah, I mean, I agree with Marjorie, talking to doctors and just getting out there. And I know that both of our teams do that with Push and March for Moms, because that's where the change is going to start, and talking to medical schools and realizing we say it all the time, stillbirth still happens and our babies still matter. And so we should all deserve answers for what happened. One, so that we can better prepare ourselves for future pregnancies if we choose to do that. And two, to enact change so that nobody after us experiences what we have. And it just seems like such a no-brainer, which is very frustrating to see that, we have to do all of this in order to, do something that seems so simple.
Absolutely.
Yeah.
Yuliya, I'm interested into how you as a midwife got involved in this.
So with March for Moms, I'm assuming.
Yes.
So I actually, Ginger, our steadfast leader, lovely president of our organization, she's a midwife. So this our organization was started by Ginger Breedlove and Neil Shaw, who are a midwife and an obstetrician, respectively, and they started March for Moms to bring attention and really make an impact at the federal and local level to show our legislators and those empowered that maternal health crisis is ongoing, and that families haven't had access to even, just beyond even the worst outcomes, things like paid leave and childcare, just really as a whole family, we don't have a lot of family support in the United States. And through my connection with Ginger, who was my midwifery faculty, so she taught me how to be a midwife, I became involved in the organization through her, and really have been there from the beginning. And we hold an annual event on the National Mall in DC to kind of really come to, where the laws are passed and show our legislators that this is important. And so, yeah, I've been involved from the conception, and then we do have another event this year on June 5th in DC.
I will be there.
Tell us more about that, June 5th. Maybe many of our listeners don't know.
So June 5th, it will be on the Wharf in DC. So a little bit of a change of a venue, but it's typically we hold a very family-friendly event with speakers from all kind of walks of the spectrum with this big issue that we're undertaking. So like I mentioned, we try to touch on family support, like socially paid leave, childcare, and then more morbidity and mortality. So we try to have a great mix of speakers, of advocates like yourselves, who are so important, and we want their voices to be heard. And then experts like obstetricians and midwives and just other people, lawmakers, and we mix in some entertainment, and it's usually an outdoor family-friendly event. So we have activities for kids, and it's just a really good time and a good mix of getting the information, but also making sure that we are uplifting families and also providing kind of like, a space where you're seen and heard. And it's okay for if there was a complication or something that happened, because you're in a space where lots of people are aware. Okay, so then we can use all of our collective power to spread that awareness beyond our event. And then we typically do an advocacy day around that time. That date is to be determined, where we meet with lawmakers. So we take families to the Hill and make appointments with our legislators and talk to them about the importance of passing legislation. The most important part of that is bringing families. Like, I always try to get as many families to go from different districts, because those are the voices we need to hear.
Absolutely.
Mhm.
I know we have another question here.
Great.
So there are a couple questions. So the first one is, if there's one thing that we can do to prevent maternal death, what would it be? And what are the top 3 causes of maternal death?
That's a great question. Okay, am I going to take that one? Okay. So there's not one. I would love to have such a one top thing that we can do. Answer to prevent maternal deaths. The best thing we can do is to work collectively across all different institutions, both legislative and private, and nonprofit, to address this problem together. That's my personal opinion, and I think a lot of people would agree that it's a multifactorial issue that we've already pointed that out. So addressing education, addressing funding, addressing social support, and kind of addressing the whole maternal mortality problem that way. One of the big top 3, or the biggest causes of maternal deaths, tend to be cardiovascular disorders, so high blood pressure, hemorrhage, so bleeding too much, and then many other causes kind of weave into a really long list. So having diabetes and infections. So there's a whole host of things. Many times people can experience more than one problem at a time. So it's not just one issue, but those are the documented most, highest causes of maternal deaths. And our Centers for Disease Control and Prevention are the ones that collect those numbers. So going back to data collection, we definitely need better data collection for maternal deaths as well, especially in 1 year after birth, because those still count as maternal deaths up to a year after you have a baby.
And that's all in Momnibus as well, different pieces of legislation specifically for the data collection and all that. Is that a part of Momnibus? Okay.
Yes.
Okay.
Yeah. And data collection too, for having education for providers as well, and requirements. Like California is a big one that passed bias legislation, so all providers are required to attend racial bias education as part of their healthcare licensure, and be aware of that being a problem, or that being a cause of poor outcomes.
Can think of a lot more states that need that.
That's incredible that they're doing that, because I mean, one thing that always sticks in my head is Serena Williams' story of how here's this woman who was like well known around the world, right? And she's giving birth and nearly died because no one was listening to her, right? And it goes to show you, it doesn't matter, you can be a person of color with a lot of money, but yet still a person of color, and so no one is listened to, so it's important. I love that they're the expectation is to have those conversations and those trainings for the medical healthcare workers, that we should be listening a little bit closer.
Absolutely. Trying to see if we have any more questions.
Yeah, and sadly, her story is not an outlier. It happens to so many women.
And Allison Felix had a similar story, if I remember correctly, right? I don't remember the details exactly, but she's another person, that's out there, right? And still had a traumatic experience. And so if it's happening to women like that, then the experiences that some other women in this country and birthing people in this country must be having are horrific,
Yeah.
Okay, I'm trying to go through some other questions that we have. So how can partners help support the birthing parent to make sure they get proper care during pregnancy and postpartum? And how can they feel more included and not like they're on the sidelines? Trying to think. I'm trying to think for my pregnancy with my partner, everything was challenging because it was COVID. Luckily I was in a space where, I could have him there. I know many hospitals in the DC area were not like that. I feel as though in those appointments, prenatal appointments, everything is directed towards the birthing person, right? And I get it, obviously, but I think that providers could maybe kind of also make sure that the partner is also educated. And I feel like there's a huge part of that that gets missed. Even if we, shared with partners about things like count the kicks, or, if your partner is high risk, here are some things to look out for that they might not realize is happening to them, but you as their partner might see. And again, I feel like these could just be delivered in, the ways like how we have our empowered pregnancy tip sheet, just a pamphlet or something with just a few key things that partners could look out for, for the birthing person. I don't know if that's too much to put on providers. What do you think? Or
no, not at all. I tried to, it's actually surprising, like many partners just feel like even taken aback when I ask them their name or like if they have any questions, because they just are not included many times. Which I see you nodding, so I think you agree. But yeah, I mean, I always say this is a lot of, this goes back to a lot of mental health counseling for like postpartum depression, but many times you'll hear providers say to their family, like, you'll be the first to see this likely before the person realizes maybe they're struggling. So the same goes for a lot of pregnancy complications or conditions or just questions. I think having that kind of a little bit more I hate to use the word objective, but just somebody who isn't going through it, be like, nudge you a little, hey, like you should call, you should ask a question.
Right, exactly.
So helpful.
Yeah. And also, oh gosh, I had a question.
Yeah.
Of course, now I forgot it the second I think to ask it. My question for you is, as a midwife, do you look at each pregnancy as high risk? Even though, you could be low risk, right? But do you treat each pregnancy as if it is high risk? And what are your thoughts on us kind of, trying to make change in that space where, everybody gets, extra testing done, and, something that is important to me. And I know a lot of other families in PUSH, EPV is just a standard practice, whether you've experienced it before or not, it's just a standard practice of care. What are your thoughts on that?
That's a great question. I would say just the model of midwifery and being trained to be experts in normal pregnancy and supporting families through an uncomplicated pregnancy or one with maybe slight complications, but nothing that would require physician referral or collaboration. We don't necessarily, I would say, approach every pregnancy as if it's high risk just based on our training. However, our training is very deeply rooted in options and giving families all of the options, whether they're high risk or low risk, and then supporting them through making a choice that's right for them. So a big kind of genetic screening is a great example. Somebody might be having 0 risk factors for a genetic abnormality, but that does not mean that shouldn't be offered to them. So, we kind of pride ourselves in being very, very strict on offering all of the options and helping people understand all of their options so that they can make the best decision for themselves and their family. Whether they're considered high risk or low risk in kind of our medical midwifery model of care. So that's kind of the best way I can explain it.
Yeah. And I feel like with options, I mean, just thinking back to my own pregnancy, I was told with the genetic testing, didn't really need it. And I still wanted to because it was my first pregnancy. And I was like, oh my gosh, I have to do all of the things to make sure that we're okay.
Yes.
And it came down to, okay, well, you might want to check to make sure your insurance covers it first, because it will cost this amount of money. And again, every family has different situations. For me, I was like, I will do whatever it takes because I just want to make sure everything is good. But not everybody is in that position. And that should not even have to be a thought when making a decision like that. Whether or not, it's covered by insurance, that shouldn't even be a factor. Options should be presented, and we should be able to follow up and, use those options that are presented to us for the health of ourselves and our baby.
Yeah, I agree with you. We also do a lot of screening, all families for complications, whether they're at risk for one or not. So depression, everybody gets at least 2 depression screens through their pregnancy and postpartum. Preeclampsia, screening them, not just by looking at your blood pressure, but really truly asking you the signs and talking to you at your appointments. Screening for, your baby's well-being, movements, kind of patterns of how you feel your baby's doing, any kind of physical symptoms you might be experiencing. So that part of it, I would say, kind of, the routine part of those visits, but we're asking those questions of everybody, not just people who are, might be at an increased risk for complications.
When you say are you talking about your particular practice?
Yeah, and I would say just how we're taught in midwifery school, asking those signs, and really in the obstetrical model of care, you should be asked those things. And I would say that goes back to like self-advocacy, right? If you're not being asked, ask why, or, ask, oh, am I not being asked about XYZ because my blood pressure is great? Or like, when do we start talking about screening for preeclampsia, or when do we start talking about kick counts? I think with the power of one of COVID came with so many challenges, but one of kind of better things I've noticed is that people are getting a lot more information through online and like TikTok, actually. Like there's a lot of great influencers out there that are talking about these things, including Anna. She did a great, TikTok.
She's a TikTok superstar.
Yes. And people come to me and they say, oh, like I heard here that, I'm supposed to start counting my baby's movements, and, it might be like a week early before I would normally do it, but I'd be like, great, yes, let's talk about this now. Yeah. So, it's kind of a combination many times.
I think what I'm realizing sometimes is you don't know what you don't know. And I think that's the hard part when it comes to pregnancy, especially if it's your first child. You don't even know what you're supposed to be asking. And for me, our loss was with the midwife. I opted to do a birthing center. Thank goodness it was in a hospital. But honestly, I didn't know what I was supposed to know. And when you guys were speaking about genetic testing, I didn't have a choice. I was supposed to do genetic testing. They just told me it's time for genetic testing. So I'm surprised now that I'm hearing that it's a choice, because it wasn't for me. And I've delivered 2 babies. So like, it's amazing to me how things, are changing, so I guess my question would be like, if you don't know, how do you find out? Like, if it's your first time, like, where should be, besides TikTok, can you be getting this information?
Yeah, I mean, good kind of most accessible place is always looking, depending on where you are in pregnancy, is looking for reading on your own. I would say I always check out my library's pregnancy book section just to see like what's there. And there's always great options. And then as we move further in pregnancy, along with your provider, whether you're seeing obstetrician or a midwife, speaking with them. And then prenatal education classes are also great, and starting them in your second trimester even is a good idea. So you can have, they're usually a series of classes, and then hiring a doula is also great. And it's never kind of too early for a doula. So they can be, like Elizabeth was saying, she was able to text and ask questions. So it's also individualized approach. A lot of parents are busy and families are busy and aren't able to attend classes. So there's lots of different resources that you can pick based on what you prefer, but reading and classes are two biggest things you can do on your own time that aren't social media, although that can be very tempting.
Especially in this day and age.
Yes, very much.
I didn't have that luxury, my goodness.
There you go.
Well, and not everything on social media is to be trusted as well, right? And so then we have that whole issue, especially as I'm learning in the, birthing space as well, lots of misinformation and just, misguided advice. So there definitely needs to be a balance.
I agree.
So let's talk more about the legislation pieces, because there is so much on the table, and I want everyone watching to know exactly what they can be doing to help further the missions and the work that we have going here. Mm-hmm. So how can we kind of fuse together what March for Moms is already doing, and what can we at Push do to help amplify it? Also, bring in our point of view with Stillbirth. What can we do to make sure that all of these things are passed and work together? And what can everybody watching do, either whether it's a big thing that they can do or a simple click with a mouse?
Yeah, great question. So the easiest, most accessible thing, especially in times of COVID, when maybe your legislative offices might not be scheduling in-person appointments, and I know that some are, is to reach out to your legislator. There are materials on our website, and perhaps we can post that maybe in the link after we chat. That give you step-by-step instructions on how to find and then contact your legislator. You can do it, like Elizabeth said, from just sending them a message on their website, or using like a pre-made letter that many organizations have supporting the Momnibus bill and the Stillbirth legislation that was just introduced. And the other thing you can do is have an in-person meeting with them and tell your story, tell them why this is important to you. It doesn't have to be, it can be friends and family, just people who support this cause, that can just share what they've learned and why it's important to them. And then, using all of that collective information, and then really a lot of families go, I think we've touched on this, not just through one complication. Many stillbirth parents undergo other complications, like increased chance of bleeding and having placental problems. There might be more than one outcome that they're processing and is a part of their story, and sharing that is really important. The Momnibus Package was drafted and put together by the Black Maternal Health Caucus in Congress, and we've already touched that, racism and women who are Black, non-Hispanic, and Alaskan and Native American have higher rates of both stillbirth and maternal mortality. So just even pointing that out as a big problem within our system is important, because the bill focuses a lot on racial disparities. And, I know we've touched, I don't know if there's been, I know the stillbirth legislation was just introduced, which is so amazing, in both the House and the Senate. And sending a letter to your legislator is helpful. And then there's also a pre-made social media campaign we can also share in the comments that has been put forth for the public to use to send a message to your legislator. So the short answer is reach out to your legislators and tell them how important this is to you and to your family. And however you do that, there's no wrong way to do that.
Should a letter to a legislator be one for Momnibus and the other for the Stillbirth Prevention Act, or together?
Separate, because they're separate packages. Yep. So if you want to show support for
like I support both, it's do one and then the other. Okay, that's helpful.
If you're having a meeting with a legislator or their aide, you can just bring up both in the same meeting and just say, there's a couple pieces of legislation that could really help us address these problems, and this is the two, and this is why they're important.
Okay.
I don't know if you saw this question. There's a student, Aaron asked, as a community health nurse and a current MSN student, what could she do to advocate for more funding in this area?
That's a great question. So as I used to be a community health worker, I used to be a community health nurse that visited moms and babies. I can sympathize very much with noticing how much more funding we could do with. A lot of times local funding comes from local funding sources, so either the city or the state. So watching and reaching out to your local officials, so state officials, the state public health department, and also your professional organization that you belong to through your profession. So this person sounds like they're a master's in nursing student. So finding your professional organization and looking on their website for resources on how they can maybe join a local affiliate or local chapter that many times works on all of these issues, like funding and bringing awareness.
And is March for Moms, do you have a base in Los Angeles? Someone was asking, they would like to get involved, but they live in Los Angeles.
That's a great question. We do not. So we are, we don't have like big headquarter offices, but our event is held in DC every year, and it's live streamed, and that's part of the way you can attend as well. So a lot of not just our DC event, but many others are live streamed. One way to also get involved is to participate in our campaigns, to like letter writing campaigns to our legislators. You can make a donation. We're a nonprofit organization. You can also buy like merch and just enjoy a great pullover sweater and show some support. And then tell your friends, tell your family that you saw us, you saw Push for Empowered Pregnancy. Just really getting the word out there is the most important. So even if you feel like you're far away from the event that's happening, you're not far away from this problem. We're all affected by this.
Absolutely. Well, are there any more questions in the chat, or if anyone has any? We have, about 10 minutes left if there are more questions. So if anyone has any, please feel free to put them in the chat, since we have a policy expert with us here this evening.
I don't see any more. But I like what you said, Yuliya. I always tell people they don't need to wait until it's either happened to them or a family member or a friend to get involved, right? It's like we have to all be in it together, right? Because if it's like standing up for a person of color, right? You don't have to be that, that color to defend or to stand up, And so I think if women and families united, we can really make a difference in terms of like making sure that women are alive to raise their babies. That's very important. And for our babies to come home.
Yeah. We at Push, we say we wanted families to make it home safely together. Right. And, that's the baby, that's the birthing person, everyone, the whole family needs to make it home safe together. And then once they are home safe together, know that they are healthy, or if there are issues, complications, that they have a safe place to go to where they'll get the help that they need. So not only do we want families to make it home safely, but once they're home, we need them to continue to thrive once they're there as well.
I agree.
And I did learn something new. I did not know that postpartum was for a year, and in the sense of like, if a mother passes away a year after birth, that is considered part of her birth experience. That's really intense.
I feel like most people probably
Thank you
would
for
not
information.
think about that.
Yeah,
No?
there's
Yeah.
lots of deaths happen postpartum.
Mhm.
And even just quickly, like even with our big opioid health crisis, a lot of times those are also moms that are affected by that can have higher rates of overdose or complications related to that. So there's lots of things that are ongoing for postpartum that are challenging for moms who are low risk. You know, we've touched on that term, but it's rarely, it's rarely easy when you're low risk. So there's even more difficulties when you're having other problems going on.
Yeah, definitely. Just want to say thank you to our executive director, Samantha, for putting up the links for March of Moms and for PUSH, our advocacy and legislative work. So if anyone is interested, you can go to the FB live chat, and the links are there for you.
Yes, and please make sure you're following March for Moms and PUSH on social media. Not only is the March for Moms event happening in June, but also in October, we have the big PUSH event. If you're not familiar with that, you can go to, Sam, if you can drop that in the chat, but if you go to pushpregnancy.org, we have a link there that will take you to the big PUSH website, where, we're very happy that March for Moms is joining us there. We have a lot of partner organizations to just really amplify the need for more emphasis to be put on stillbirth and maternal mortality, so that, as I said earlier, families can make it home safe together. So, Yuliya, thank you so much for being here with us tonight. And we also will be collaborating with March of Moms, ongoing. So please look out for more lives, different social media things that we post with statistics, and please share it. When Marjorie was, saying how it shouldn't take you experiencing something for you to be a part of trying to fix it. And I feel before stillbirth happened to me, I didn't know anything. I didn't know that mothers were dying at the rates that they are. I didn't know that babies were dying at the rates that they are. And so I think it's going to take groups like ours to really amplify our message, let everybody know how urgent this is, and finally make it so that everybody knows about these issues, not only families that have experienced it. So everything that both of our organizations post, please share it with anybody and everyone, because that is how we are going to solve these problems in our country.
Yes.
All right, everyone. Well, thank you. Have a great night.
Thank you so much.
We'll meet again here soon for another Facebook Live sometime soon.
Yes, thank you for having me.
Bye.
Bye. Have a good one.